I want to begin our discussion of our therapeutic options by taking a step back and looking at something that seems so basic that we might overlook how it affects our choices about our treatment. Hi, I'm Brian Kaufman, a doctor turned CLL patient and the medical director of the CLL Society. What I want to talk about in this segment is about taking our medications either orally or by infusion. And I want to start by dispelling some myths. It is not true that the only way to get real old school chemotherapy is by giving it IV. Chlorambucil is a direct child of old school chemo. It's a mustard gas descendant, and it's taken orally. Fludarabine, probably the most common chemo drug used in CLL and the backbone of FCR therapy, was available as a pill in the USA till 2008 and is still available in Canada and elsewhere around the world. Studies have shown that it has similar or maybe even better efficacy when taken orally as compared to IV. And there's also no truth to the belief that IV therapy packs a bigger punch than oral meds. This, unfortunately, is a double-edged sword. And if we have a severe reaction, odds are, if we're taking a pill, we're at home, not under the watchful eye of an oncology nurse in an infusion center with an already established IV access so that they can administer potentially life-saving medications in a heartbeat. So when choosing a pill over an infusion, we need not be giving up any potency, but we're also not shedding any risks. Cost is another factor. The myth of saving money by swallowing rather than infusing our therapy is also rapidly dying. Today, while some oral meds, such as prednisone, cost pennies, many others may exceed the price of IV therapies. And we know that insurance coverage varies widely from state to state and from country to country. And often, ironically, drugs that are administered by a medical doctor in an office or an infusion center or hospital may have lower copays and lower out-of-pocket costs for us patients. So what are the real differences between oral and IV therapy? Adverse events can occur in both, but obviously some IV drugs carry a different set of risks, such as bruising, infection, and blood clots at the infusion sites. These, however, are extremely rare and are not usually an issue with the particular drugs that we receive for our CLL, but it's always a good idea to try to save our veins. Pills are certainly way more convenient. Most of the time, when we are already established on a safe and stable dose, we can gulp them down in our PJs in the privacy of our home. They are portable and accessible when we travel. But that convenience carries a different set of concerns. Absorption can be affected by what we eat and what other medications we take. We don't usually read the package insert on our infusions, but we better read everything that comes with our oral medications. Some pills' pharmacokinetics are profoundly impacted by what else we ingest. Moreover, other illnesses or rarely complications of our own CLL can interfere with our ability to get adequate doses of the medication when taken through the GI tract. The medicines themselves can cause local gut reactions, from minor diarrhea to life-threatening colitis. And this leads me to the last and perhaps most critical difference. We are ultimately responsible for taking our pills. You can bet the hematologist office will be on the phone with us stat if we miss an infusion appointment, but they are not monitoring our medicine cabinets. We are responsible for being adherent and persistent in our pill popping. And if we look at the track record of our fellow patients with the cousin leukemia, CML, where skipping dosage is the leading cause of developing resistance, we cancer patients are not doing such a great job of caring for ourselves. So in summary, while the decision about oral versus IV may be moot for many of us, as we may only have one logical therapeutic choice that is only available in one form. When we do have a choice, we should make our decision on the particulars of that drug and our willingness to embrace the responsibility of being our own chemo nurse if we choose the pill route.